Xo'jamqul va Maryam, biz Uzbekistan, Surxondaryo viloyatidan keldik. Xo'jayinim jigar transformatsiyasi uchun Dehliga O'zbekistondan vrachlar tavsiya qilib, shu orqali shu yerga keldik. Men xo'jayinimga donorlik qildim.
So she is Maryam and he is his husband, Mr. Gulomjon. They came for liver transplant in Aakash Healthcare Hospital in Dwarka, Delhi for their liver transplant.
Xo'jayinimda ichida shishlar paydo bo'lgan edi. Suvlar bor edi. Bizga vrachlar jigar transformatsiya qilmasak iloji yo'q dedi. Men shu yoqqa kelib Aakash gospitaliga operatsiya qildirdik. Operatsiyadan yaxshi chiqdik. Ikkalamiz ham yaxshimiz.
So they came in emergency for treatment of liver transplant. As they didn't know they are facing issues of liver transplant in their country. Some local doctors suggested them for a liver transplant in Aakash Healthcare Private Limited.
Bu yoqqa kelgandan keyin bizga Tashkent yuborgandan keyin Toshkentda vrachlar bu yoqqa Dehlidagi Aakash gospitaldagi doktor Saurabh Singhal o'zlari operatsiya qilib, mana operatsiyadan yaxshi chiqdik.
So they came for treatment from Tashkent, Uzbekistan in Delhi for treatment under Dr. Saurabh Singhal, Head and Director of Liver Transplant.
Hi, I am Dr. Saurabh Singhal. I am the Head and Director of Liver Transplant, Hepatobiliary Surgery, Robotic Surgery and GI Surgery at Aakash Healthcare, Dwarka, New Delhi. Today we are going to talk about this very interesting case, Mr. Gulomjon, who came to us from Uzbekistan in a very sick condition. This patient had been suffering with HepatitisB and HepatitisD infection, which had almost completely destroyed his liver. And when he presented to us, he was very sick. He had a lot of water in the tummy. He had multiple episodes of bleeding, and he also had effect on kidneys and brain because of the liver. So when the patient came to us, he came to us with a lot of hopes. We evaluated the patient thoroughly. And after evaluation, we realized that the patient had an end-stage liver disease. When we are dealing with the end stage of liver disease, these patients benefit significantly with a timely liver transplant. So when we explained to the patient that the liver transplant is the only modality which can cure him, his wife came forward as the potential liver donor. We evaluated her in detail and we found her to be a fit donor.
Operatsiyadan yaxshi chiqdik. Xo'jayinim ham yaxshi. Operatsiyadan oldin shishish, suv bor edi qornida. Undan beri o'zini yengil qilib, operatsiyadan keyin yengil his qilib, ikkalamiz ham hozir yaxshimiz.
So they were facing issues of stomach, having liquid fluid in their stomach, and the swelling problem was also there before the liver transplant. But after they came in Aakash and getting treatment done under Dr. Saurabh Singhal, they are having now no problems with them. There is no swelling and no fluid in their stomach, and they are feeling like normal as before.
We proceeded with the liver transplant after all the legal proceedings as per the law, and the liver transplant went very well. We had this patient who was actually dancing on the day 6, day 7 after surgery. He was recovering so well. He had a marvelous recovery, and now after almost a month of transplant, he is doing very well. He is currently in India and is planning to go back to his country. His liver is functioning very, very well. So this patient is an example and is a message to all those people, all those patients who are suffering with end-stage liver disease and are in a very bad state, that a timely liver transplant can actually save life.
Agar O'zbekistonda bizga o'xshagan bemorlar bo'lsa, bemorlar bo'lsa, biz Hindistonga kelib davo shifo topishini maslahat qilamiz. Bu yerda hamma sharoitlar bor. Nasib bemorlarimiz yaxshi bo'lib chiqib ketadi. Mana bizlar yaxshi bo'ldik. Hammasi uchun hammalaringizga rahmat.
So they are completely satisfied with all our services from Aakash Hospital. From their pickup till date, after the liver transplant, they are feeling very excited to go back home and recommend more patients to Aakash. So they are completely satisfied from our services. Thank you.
Liver transplant is the marvelous miracle of the medical science, and the liver transplant in the current world is absolutely safe and has marvelous results with very little complications. So if you have any queries regarding the liver transplant or the liver disease, or if you have any patient in your family who is suffering and is in a very bad state because of the liver disease, you are most welcome to come and visit us at Aakash Healthcare. I and my entire team of liver specialists are always at service, and we'll be very happy to evaluate you, guide you, try to treat you medically as much as possible, and if required, do a liver transplant and to try to give you the quality of life that you really deserve.